I'm Al Bledsoe, Veterans of Foreign War, Post 1108.
I'm Ron Chapell, chaplain at VBA 777 here in Richmond, Indiana, and I'm co-host with Al here at Proudly We Serve.
And today's guest, we're going to have a gentleman from Reid Health. And could you introduce yourself
Jason?
and tell us where we're at?
Sure. My name is Jason Woods. I am the community liaison here at Reid Health PACE, and I just want to say it's an honor to be here. Thank you, gentlemen.
Well, we're glad that you're here. The program is for and about veterans, and so we're taking a new kind of a slant this year to bring in services that are non-military, but that focus on giving special attention to veterans. So when we heard about PACE, I heard about you at another event, and thought it would be good to bring you on to talk about what you guys do for veterans. Yeah.
Yes, sir.
Yeah.
When did you start PACE at Reid Health? When did all that start?
So the program itself has been in development here at Reid for a couple years now. Myself, I came on board January of last year, and we were set to open mid last year, but with COVID and everything that took place, it kind of set some things back. So we kept plugging along, and we finally were able to open our doors November 1st of this past year. So we are proudly accepting participants now and trying to get the news or the word out there about PACE.
Okay. So what is PACE?
So PACE itself is an acronym. It stands for Program of All-Inclusive Care for the Elderly. So whenever you see the word PACE, it's going to be in all caps because of that reason. And what it is it's a revolutionary program. It's it's an innovative program that is designed to help individuals, the aging population that is looking to have to go into a nursing facility or some sort of long-term care facility, stay in their own home. So we want to help individuals age in place, and we want to bring the entire continuum of healthcare services right there to them.
Mm-hmm. So are there specific eligibility requirements for people to be able to get into a PACE program?
Yes, sir. We have 4 main eligibility requirements. The individual does have to be 55 years or older. They have to live within our designated PACE service area. So currently we're offering this program in the 6 counties that Reid has a presence in here in the state of Indiana. That includes Randolph, Henry, Wayne, Union, Franklin, and Fayette. They have to meet nursing facility level of care. So a lot of people don't understand what that is. Even myself question it sometimes, but we have some great people here. Our enrollment specialist, Krista Gibson, and our home care coordinator, they will actually go into the home and complete that level of care with the individual, and then we'll submit that to the state for the approval. And then finally, the last requirement, and this is a very, very big one for us here, we want to make sure that the individual will be able to live safely in the community while utilizing PACE services. So we're talking about the elderly population here, the aging population. So if they're looking at have to go into a nursing facility, we want to make sure that they can remain safely in their own home while utilizing our services. So that's a very, very big one that we like to stress here.
So you actually go into the home and help that person assess the mobility through the house or whatever?
Yes, sir. So our enrollment process it's a little extensive, but it all goes back to we want to make sure that the individual is right for our program. So Krista, our enrollment specialist, and then our home care coordinator, they will actually go out. They will assess the individual in the home and just start the enrollment process, and then there will be a series of assessments that will be completed here on site if the individual is able to come here to the PACE Center. And the great thing is we provide all the transportation free of charge. So we will bring them to the PACE Center. We'll complete those other evaluations. And then everything will be put together for a care plan for that individual.
Wow.
How is that funded?
Awesome.
How is that funded? How does the person pay for all that stuff?
So, like I said earlier, we bring the entire continuum of healthcare services. So it brings together services that are just offered under Medicare. It brings services that are just offered under Medicaid. It brings everything that an individual would need, everything from primary care to specialty care, if there's any sort of behavioral health, any sort of durable medical equipment.
Oh, wow.
All of that is brought under one banner here at PACE, and it's paid for. The payer sources that we currently accept are Medicare, Medicaid, and private pay. So within the PACE world, generally we see individuals that are dually enrolled in both Medicare and Medicaid. So there's no sort of out-of-pocket expenses to them. We'll get that lump sum each month, and then we pay for all of those different services out of that lump sum that we receive.
So how does this program work with veterans?
So with veterans, veterans are very, very close to my heart. I come from a military family, and so when I signed on here at Reid Health PACE, that was one of my first questions. What can we do to assist veterans? So there are some PACE programs across the United States that have been able to work with local VAs to establish contracts to be able to accept VA benefits as a payer source. So some of those regulations and things changed with some of the bills that were passed under President Trump. So since then, local VAs are able to establish those contracts. So we're working towards that with our service area. We do work under both, or we work with both Indianapolis and Dayton VAs. I've started the conversation with our local VA here in Richmond, Indiana. I've met with their office manager, and I've made them aware of the program and the different services that we've offered. And we're also establishing a relationship with Journey Home up there in Randolph County as well.
Wow.
So we're still working on trying to establish those contracts, but we can serve veterans here with our program.
That's awesome. That's
So if a
awesome.
veteran needs the services, they just call you and then, of course, fill out all the paperwork, and then your money's going to be paid. Actually, you're paid out by the VA. It's not going to be like if they don't have Medicare, Medicaid, and all that stuff. It's going to be paid out by the VA.
Yeah, that
Or
was my
private
concern.
pay.
Yeah.
Is that
So
right? Am I?
currently, right now, we can't accept any, or we don't accept any form of payment from the VA. So there are, and that's one of the things that are still ongoing with us. So we have a business coordinator, Chaz, that does work with a lot of different payer sources and things like that. And he's been in communication with some of the other PACE facilities across the United States, where we have been made aware that we can bill the VA, but we just have to get those contracts in place. So there's a huge majority of veterans that do have Medicare and Medicaid that would be able to pay for it, and they would be able to utilize those payer sources to pay for our services. But hopefully here in the near future, we will have access to VA benefits to be able to pay for our services as well.
Okay. So a person can be seen at VA and at PACE at the same time? I mean,
So it's a very, very special population with our veterans. So generally, if somebody's not a veteran and they're receiving primary care outside of Reid Health PACE, they have to take on our primary care physician. But with veterans, it's much different. So if they are receiving services through the VA and their VA benefits are covering that, they can continue on. So for example, if they come on to our program and they start to be seen by our primary care physician, and they come to us for therapy and things like that, and there's certain groups or whatever the case may be that they want to continue on at the VA with their brothers and sisters, then they are more than free to do so. We'll open up those lines of communication with the VA, Indianapolis or Dayton, just so we can discuss what medical services are going on, so everybody's on the same page. So veterans are completely different than the general public when it comes to whether or not they're able to continue on with any services outside of PACE.
so if a PACE physician writes a script for a veteran, my question, I guess, will the VA fill that? Hell,
Yeah.
They should.
So if they're continuing on with a primary care physician at the VA, we're going to open up those lines of communication. So if our physician here at the PACE Center feels like a prescription is needed, of course we're going to contact the VA, just so, like I said, everybody's on the same page. So the way that PACE is set up, the whole reason why they take on the physician that we have here at Reid Health PACE is because we utilize the interdisciplinary team model. So when an individual, a veteran or a civilian, comes onto our program, they're not just getting a primary care physician. They're getting an entire team of 11 different professionals. So everybody from a primary care physician to a physical therapist, occupational therapist, master's level social worker, dietitian, and the list goes on. It's an entire team, and they meet every single morning, and then they meet twice a week for care planning. And PACE is designed to close those gaps in communication, and that's what our interdisciplinary team will do. If they do have a specialist, we will coordinate with that specialist because we don't have all the different types of specialists here on site, endocrinology, cardiology, et cetera, but we will coordinate with them. The same will go with the VA. We will coordinate with them just to ensure that everybody is on the same page when it comes to the care for that veteran.
Okay.
But PACE does serve veterans, and we do pay for those medications as well through the PACE program.
Okay. All right. So now, if your physician decides that the patient needs something that you don't provide, that you don't have there, the veteran, can the veteran go to VA and get that, i.e. X-ray, whatever the case may be?
They absolutely can, because their VA benefits are going to cover any sort of services that are provided there at the VA. So here at PACE, we get that lump sum from that payer source, Medicare, Medicaid, or private pay each month, and we pay for all of those different services that they utilize through us. But we also have a giant list of contracted vendors. So I want to tell you right now, if a VA physician says, hey, this individual needs an X-ray, this individual needs to see an endocrinologist, they need behavioral health, whatever the case may be, and that individual cannot get to the VA for those services, we will cover those services here at Reid Health PACE.
And no cost to the veteran?
Nope, everything is included in that lump sum that we get for that payer source, or from that payer source. And here's another great aspect of it. So I'm not part of the financial department, but just for the sake of argument, say we receive $4,500 a month to provide every single healthcare service that that individual needs. If God forbid they have a heart attack or something and they utilize, say, $10,000 in services, we will never ever go back to the individual or the payer source and say, hey, the individual went over by $5,500. We need you guys to cut us a check. So everything we take on, all of it, we're their payer and their insurer, and if anything happens to that individual, we will cover that.
Wow, man, that takes a heck of a burden off of it.
Yeah. So do you do the services, the services that you have at PACE, are they done there? Or are they done in the home, the nurse or whatever comes out to see you? Or
Sure. So we service both mobile and homebound individuals. So if they are able to come to our PACE center, so here on site, our center is set up in 3 different aspects. We have our clinic side, our day room side, which is like adult daycare. That's where recreation, things like that take place. And then we have our physical and occupational therapy side. And on that side, we'll offer some additional services here on site, such as speech therapy and podiatry, and just some different things like that. Dentistry and optometry services will be offered here on site as well. If the individual is able to come into our center, that is great. We provide that transportation. We'll pick them up at their home, we'll bring them, and then we'll also transport them home, and all of that is completely free of charge. If the individual cannot come into our center, or if they have an appointment, say at a specialist, that they need to go see their endocrinologist, we will transport them to that endocrinologist as well with our transportation. And once again, that's all free of charge. We do have individuals that will go into the home. So if they cannot come to the PACE center, we can see them via telehealth, or we can actually see them there in person on site with the use of our RNs, our LPNs, and our NCAs as well. So we can actually provide those services there in home as well.
So now, do you schedule that person? Is there a number of days a week that person has to come, or is that determined by, their situation? How's that figured out?
Yeah, the PACE program is truly individualized. So the PACE program is not going to be the same for every single person. It's
Okay.
truly based off of what are their needs. So we may have individuals that come to our PACE center, 1 day a week for a couple hours, or we may have individuals that come to our center 5 days a week, all day. Or we may have some that just will not, come to our center for whatever reason. They're homebound, or whatever the case may be. If they prefer to be treated in their own home, then that's something that we can work with. So the program is completely individualized, and somebody, they may need PT and OT, or they may not. They may just need to see our primary care physician and come in and utilize our day room for a few days. So it's a great program, and with us offering that entire continuum of healthcare services, we can individualize it for every single person, and that's done through the care planning process that our interdisciplinary team does.
Yeah.
And we are completely transparent too when it comes to the care plan. Our participants, the care plans are reviewed with them, and if they have any input, we'd love to hear it. We want their input. We can take that back to the interdisciplinary team for it to be added to their care plan. But they have to sign off on it. So we want to be completely transparent with them at all times as far as the care that they're receiving with us.
Okay.
Does Medicare pay all the charges that you have?
So if they have Medicare only, there will be an out-of-pocket expense for them each month. So with that, though, we will try to get them onto Medicaid because the income guidelines do raise when they want to come onto the PACE program. So that's another service we offer completely free of charge. We will attempt to get them on Medicaid. If they have Medicare and Medicaid, there's absolutely no expenses to them whatsoever. They don't have to pay anything out of pocket for medication, services, nothing. And then if they're private pay, of course, there's going to be that, that monthly pay that they have to do. So, but once we have established the payer source, all of those different services, whatever is written into their care plan, whatever services that individual is receiving, it will be paid for out of that lump sum that we receive each month, and they don't have to pay anything additional out of pocket.
Okay, my thought though is if I only have Medicare and I come to get services there, and my services create an additional out-of-pocket expense, but I'm not able to afford it. My budget, I'm living on Social Security, and that's all. I'm just saying, scenario-wise, living on Social Security, that's all I've got. How do you determine how much that person pays per month? Let's say it's $10,000. You got, do they get hit for $500 a month, or do they, $50 a month? Who makes that determination?
So we have it's simply a set price here, and once again, Chaz, our business coordinator, he does a phenomenal job with communicating all of that, and so does Krista Gibson, our enrollment specialist. They're the ones that meet with the individuals, and they go over the financial portion of it. But it's a set price. It's not $50 for this person and $5,000 for this person. It is a set price that we do have if the individual is Medicare only. And like I said, there is no other out-of-pocket expenses other than that portion that they have to pay each month.
Right.
And everything has gone over with them before they even join our program.
Yeah,
So we don't ever want somebody to join and then say, "Oh my goodness, I had no idea it was going to be this much," or whatever the case may be, and then want to back out of it.
My point is, though, on that out-of-pocket expense, okay, so the service charge is the same regardless. But
Yes.
if the cost is $10,000, $15,000 or whatever, and my income would make it difficult for me to make payments on that, how's that worked out? If all I have is a limited amount of fixed income, who works that out, and how's that worked out for me?
So
Because that's the situation for a lot of veterans.
I wish we had some sort of payment assistance. At this time, we don't currently offer any payment assistance, but Chaz will work very, very diligently to see what we can do to help with that. So if you are on a fixed income, like I said, we will definitely try to get you onto Medicaid, because those income guidelines do raise, and I believe it's around $2,200 a month that an individual can make and get onto Medicaid, so there would be no out-of-pocket expenses. Sadly, we have ran into a few individuals that they're Medicare only, but they're over resources and they don't qualify for Medicaid, and they're unable to join our program because they're not able to afford that out-of-pocket expense each month. So in those cases, it's very, very difficult. When we started developing the PACE program, we were told that 98% of the individuals that we come across are dually enrolled in Medicare and Medicaid. But here in Wayne County, we do have a higher population of Medicare-only individuals that do not meet the income guidelines for Medicaid. So we've had that little tricky situation a few times. It is sad. But you also have to keep in mind, if an individual is looking at our program, they're probably looking at having to go into a nursing facility as well. And when that happens, they have to spend down how much they have in their bank account. So, we've just encountered some people that don't want to take those steps because they really, truly haven't reached that point where they're looking at having to go into a nursing facility.
Yeah, that was my next thought. Is if people might think, well, if I go into the PACE program, is that my last step life experience?
Yeah.
Or is there an effort for me to have a discharge date to get back to my quote unquote normal lifestyle?
So with PACE, generally the individuals that join our program, they're in it either for the rest of their life or until something happens, they've lost a family support system, or their health just deteriorates to a point where they truly need to go into a nursing facility. Our program is completely voluntary, so you can disenroll at any time that you want. That's why here at PACE we call our individuals participants rather than patients, because they choose to participate in our program. But generally, they're in it for life. We don't have a lot of data to go off of here locally because we're such a brand new program. But just looking nationally, once somebody joins the PACE program, they're able to keep that independence. They're able to stay in their own environment, and that's what they want to do rather than going into a nursing facility or assisted living facility.
Yeah.
So they generally stick with us.
Well, I know that the state of Indiana does have some special funding available for veterans. And if you're in a crisis situation, something like this might qualify for that.
Yeah.
I'm
just wondering if you've I'm trying to follow this a little bit. I've been sitting here just listening to it. So if you're a veteran, you're 55 years old, you have no Social Security, you have no Medicaid, you have none of that stuff, and you're a veteran, and we come to you, or I come to you and say, I want to join PACE, what are you going to tell me?
We're going to try to get you set up. We did have one individual that came to us. He had no Medicare, no Medicaid, none of that stuff. And our team here, we worked with him to try to get him onto Medicare and Medicaid. So it does make the enrollment process last longer because we're basically starting at step one. But we have a great team here, a fantastic team, and we will do everything that we can to help that individual get onto the right track. And even if they need assistance with signing up for VA benefits, we will definitely find the person to connect them with so they can get that assistance as well.
Good.
So you would go to the VA for the payment rather than the individual?
So once we're able to accept the VA benefits, sadly, we wouldn't be able to enroll that individual into the PACE program until we were able to get them on to the Medicare services or Medicaid. We just need to make sure that payer source is in place. Because if not, then sadly, the entire burden of the payment would be left on them through private pay. And that's burdensome for especially our veterans.
So you don't go to the VA for the actual payment itself then, if they're not on the Medicare or Medicaid? Am I
Well, what you're saying is
right?
that they will work with them to all of the sources to get a source that will actually
Yeah,
give
but
them the
what
funding,
I'm saying
right?
is, what if that don't happen?
If they don't get the funding
Yeah.
from anybody, then
What do you
it's-
do?
the burden's on them, right? I guess.
Well, yeah, they would have to pay for pay services through private pay, but we don't ever want to leave anybody just out there stranded without any sort of services or anything like that. So we get referrals in, and if the individual is not right for our program for whatever reason, we want to get them connected to the right program. So that's where our community partnerships come into place. Like I said, I've been working with our local Richmond VA, and then also with the Journey Home program up there in Randolph County. So we're developing those contacts currently. So if we do get a veteran that for whatever reason cannot get on Medicare and Medicaid, we want to get them to a service that will help them. And that's something that we just offer as a giving back to the community. We want what's best for everybody, so we will assist that person as much as we possibly can.
Right. Well, there are resources available for a veteran who would not necessarily have immediate access to funding, privately personal funding, or through insurances. There's funding available to help. It may not take the whole thing, but it might allow them to at least get started while you guys are working with them through the process.
I'm just worried about if the service is provided and they have to be paid. That's what I'm trying to get to. Who pays that?
Well, that's what I'm saying. If we don't
But
have,
you're talking a limited funding, though, aren't you?
right, it is limited,
yeah.
right? But I would hope that these guys are going to be aggressive enough pursuing funding for that person. Okay. Yeah.
Yeah, we will absolutely do everything that we can, and these special funding sources.
Yeah.
I'm trying to get another meeting set up with our local Richmond VA, and then here shortly, because we've been establishing some other contracts, but
Okay.
hopefully here soon we'll be able to get our executive
Right.
team set up to where they're meeting with the Indianapolis VA and the Dayton VA, so we can get these contracts in place, because we want to do everything that we can for our veterans. And in the meantime,
Okay.
we will explore those additional funding sources if there are no other funding options available.
Okay. We're past 30 seconds here. Real quick, Jason, where are you guys located?
We're located right here in Richmond, Indiana, 2300 National Road West. We used to be the old county market. Please feel free to give us a call or visit reidhealth.org/PACE, and you can get all the information on our program, and you can even take a virtual tour of our facility.
All right, Jason Wood. Okay, well, ladies and gentlemen, you heard it right
Yeah.
here at Proudly We Serve.
Thank you very much.
So, Jason, thank you
you.
so much for coming on, and we hope this won't be the last time. Something new happens in your organization, give me a call, and we'll get you on.
I
All right.
appreciate your time, gentlemen.
All
Thank
right.
you so much.
Thank you
All
very
right,
much.
thanks, folks. Thanks for watching Proudly We Serve. See you next time.
Cronin Toyota and Cronin Nissan are honored to partner with Proudly We Served, as well as the continued support of our local active and retired military veterans across eastern Indiana.